Hello, if you're watching this video, very likely you have some interest or are curious about some of these newer medications that are out there that can help with weight loss. You hear on social media celebrities talking about this miraculously new medications that actually help with weight loss. They've lost all this kind of weight and they're happy as clams. All right, welcome everyone. This is Dr. Clark from the Center for Weight Loss Success. And today I want to talk a little about some of these newer medications. You've very likely heard of them, semaglutide as well as tirzepatide. We'll talk about these are new injectable medications, once a week injectables. Subsequently, then people lose weight very nicely with it, and it may end up being easier to keep the weight off. So we're going to talk about this in detail. We'll talk about kind of how they've come about, what they're used for, can they help with weight loss, what are the risks, who shouldn't do this, and then kind of, if you're interested, how to get started here at the office. All right, so the medications are called semaglutide and tirzepatide, and they are new injectable weight loss medications, and yep, they can work. All right, so a little intro here about weight loss. As you know, if you've tried to lose weight, weight loss is hard. But if you think about it, actually, and I've known this for the last 30 years, weight maintenance is actually even harder. But don't despair. There are a couple of new once a week medications that are injectable. They can be very effective. And if you've known me at all, you realize that I'm not one of these people that jumps on the bandwagon right away and just kind of, oh, let's start doing this because I want to know, is this medication safe? Is it going to work? Is it something that can be affordable? If you've heard about these medications, very likely you've also heard about how expensive they are. And there's some truth to that, but we have gotten a way to make this at least a very reasonable thing. Now, I've been doing weight loss for over 30 years. I've done over 6,000 weight loss surgery operations. I've been board certified in bariatric medicine, which is weight loss medicine. We've been doing that as well for over last almost 20 years. So subsequently, we see kind of what tends to work, what tends not to work. And this is one of the few newer medications that I can really get excited about. All right, so the two medications are semaglutide and tirzepatide. Semaglutide is often referred to as Wegovy. That's the brand name. Tirzepatide is Mounjaro. And both of these medications fairly new in being approved by the FDA. Both of them are approved for for treatment of diabetes, but now they're also working on getting approval for weight loss. The semaglutide has been approved for weight loss. Tirzepatide, the FDA has put it into a fast track label, but it can still presently be used off label for use for weight loss. All right, so semaglutide is approved in June of 2021. The FDA approved it for weight loss. It had previously been approved for treatment of diabetes, diabetes type 2. But early studies showed good weight loss, so they started doing weight loss studies. These early studies were showing 15 to 30% body weight loss in then approximately a year to just over a year, to year and a half. So the early studies are showing very good weight loss. So weight loss of 15%, what does that actually mean? Well, for example, if you weigh 200 pounds, 15% of 200 pounds is 30 pounds. So now, okay, you lose on average, and some people lose more, some people lose less, of about 30 pounds. That is significant weight loss. We are seeing that it's getting closer to actually what we often refer to as surgical type weight loss. So these early studies are showing very good weight loss. Now, obviously, these medications by themselves don't just work because you took them. Like any weight loss plan, you still need to do the right things. It's most effective if you're, working on a very low calorie diet, very low carbohydrate diet. You're working on increasing your activity, exercise type of thing, and that's true with any medication, any weight loss plan. So this is no different than that. Tirzepatide, a little newer, it was approved in May of 2022. So it's literally less than a year ago. And it's approved for the treatment of type 2 diabetes. It's presently being used off label for weight loss because we also see significant weight loss with this medication, and it's been placed on a fast track to get approved for weight loss itself. But right now, potentially it's actually used off label, but many medications are. The early studies with Tirzepatide actually show about greater than a 20% body weight loss. So that same example, if you weigh 200 pounds, 20% is about 40 pounds. And again, that's average. Some people lose more, some people lose less. Obviously, this also has to do with how much does some have to lose. For people who have to lose a lot more weight, they'll lose more weight. And again, it's most effective with a good weight loss plan, diet plan, activity exercise plan. All right, so what are these medications? Okay. Semaglutide, they're injectable glucagon-like peptide or GLP-1 agonists. Okay, they're given about once a week. Inject them typically in the subcutaneous tissue. It's like giving an insulin injection. Very simple. Yeah, I know it can sound intimidating, but very simple to do. We're happy to show you how to do this and help you with this. So what is GLP-1? GLP-1 is an incretin hormone. Incretin hormone means that this hormone is a type of hormone that's released by the digestive tract. And the medication actually mimics that. And these incretin hormones play a role in appetite as well as digestion. Now, tirzepatide also is an incretin-like hormone. It is very similar to GLP-1, which is again that glucagon-like peptide, but also GIP. And GIP stands for glucose-dependent insulinotropic polypeptide. These are little incretin hormones that are released along your digestive tract, along the intestinal tract. So tirzepatide again is for treatment of type 2 diabetes, but it's been placed on the fast track designation for weight loss. Presently is used off label, but we may find that this medication actually works even better than the semaglutide does. Okay, both of these again are indicated to treat type 2 diabetes mellitus, but also weight loss in adults with a BMI of greater than 30, which basically means someone just probably a little more than 20 pounds or more overweight, or a BMI of 27 with associated medical problems. Both of these medications, just if you have them at home, they need to be refrigerated, kept out of the light. So typically keep it right out of direct sunlight. All right, so how do these things actually work? This GLP-1 and the GIP, okay? So they work on multiple areas of your body. The brain is one of them, okay? But also then it can work on the whole body. It can work on the pancreas, which kind of secretes the insulin, okay? And then it actually works on your stomach. And this is one of the bigger places it actually works in your stomach because it can help you feel full, stay full. All right, so let's go through that a little bit. In the brain, basically it's helping your body realize that, hey, I've had enough food. Therefore, you can reduce your food intake. I don't need more. It really helps with hunger, so it tends to reduce food intake as well as help with increasing satiety. Satiety is kind of that feeling of satisfied, I'm full type of thing. That's going on in your brain. Now, for the whole body, both of these potentially can help with increasing insulin sensitivity. And if this is true, this is a huge part of this because we talk about all the time, or if you listen to any of my webinars, talk about all the time carbohydrate sensitivity, insulin resistance. This is that when people become resistant to insulin, then it becomes very difficult to lose weight. So if this can actually treat that insulin resistance, it improves insulin sensitivity. This is going to help not only with the weight loss, but this will help significantly with keeping the weight off. Time will tell how true that really is. Okay? In the pancreas, it does actually increase insulin. Now, I talk about insulin all the time. I talk about, gee, we want to keep insulin levels low. But in this instance, the potential there is it can help that carbohydrate sensitivity. As I talk about carbohydrate sensitivity, there's a delay in the normal insulin response. So if we can improve that normal insulin response, even though this is something that helps insulin secretion, it actually is going to help in the long run with weight loss because there isn't that delay. And subsequently, then you won't get those huge swings. In the stomach, now this is another place where it can work almost too well. Okay? And the reason I say that in the stomach, what it'll actually do is it'll slow down gastric emptying. Why is that important? Well, if we slow down gastric emptying, you're going to have a longer period of time of being full. And also, it'll be easier to get full with eating kind of much less food. You'll feel full, I'm satisfied, and you'll stay satisfied a longer period of time because physically the stomach will be staying more full. Now, when we talk about side effects, we're going to go into that because that potentially can lead to some side effects as well. But the bottom line is that these medications work throughout the body. And subsequently, it's not just one spot. And subsequently, this can be very helpful for many different reasons. Then, as different places it can work, and sometimes that can actually be kind of improve not just the weight loss, but actually improve the weight maintenance as well. All right, so just like every medication, these medications can also have side effects. And actually, if you look at the literature, there are about 5 to 8% of people that try to use a medication don't tolerate it well. And the reason is, or some of the reasons are, is because it may have some GI consequences, if you want to call them that. Some of it is actually part of how the medications work, but if they work too well, then you won't be comfortable at all. About 20% of people will get some nausea that's generally well controlled, but still there are some people that don't tolerate it well. There are a few people that will develop diarrhea, and the other end can get constipation. This isn't a whole lot different than literally any medication in the world that can do this, but it is something that potentially can cause people some discomfort. Vomiting, obviously, no one likes to vomit. So if this is something you just don't tolerate, a lot of this has to do with going slow. Okay, meaning that when you start the medication, we need to start with really low doses as one goes slow and increasing the dose, but you also have to go really slow with eating, cutting food up. So it's almost like having someone who's had surgery also has to cut things up tiny, go really slow with eating. You go too fast, you're uncomfortable. So with that, it can cause some abdominal discomfort or indigestion, some gas and burping. Very rarely can cause some fatigue. I mean, that's literally less than 2%. One thing we have to watch for, and this is true with anybody who has significant weight loss for whatever reason, is that any weight loss is associated with gallbladder problems. Subsequently, then there is a low risk of developing gallbladder problems. That's very likely related to the weight loss more so than it is to the actual medication. And then since these medications actually can slow down gastric emptying, do have to be a little careful that the potential for absorbing your normal medications may not occur quite as efficiently and effectively. That is something they're just beginning to study. It hasn't become a significant problem, but you do have to consider things like birth control pills. Are they going to be absorbed quite as well? So there are certain medications you want to be a little bit careful with because we're slowing down the gastric emptying side of the whole thing. The bottom line to that is very rarely severe side effects could occur, an allergic reaction, if someone got severe abdominal pain. If these things actually happen, obviously seek out emergency medical treatment. But reality is these are pretty Well, these side effects can be fairly well controlled, and they're not that unusual, but again, can be well controlled there. So I don't want to scare people off, but these are something that you may feel. All right. Now, there are certain people that probably shouldn't take these medications. And it's true with just about every medication in the world. And one of these is a theoretical problem. So, what we typically tell people is anyone that has a personal or a family history of medullary thyroid cancer, which is a very rare thyroid cancer, or multiple endocrine neoplasias, which are also in incredibly rare cancers. They're typically are genetic, so they usually run in families, and that's why we say either a family history or personal history. I've been doing in medical field for over 30 years. I can think of one time I've seen someone with either of these type of problems. So it's very, very rare. All right, but other people that shouldn't take this medication, if you're a type 1 diabetic, meaning you don't make insulin, or if you're a diabetic that has a history of diabetic retinopathy. Now, diabetic retinopathy you have to be very careful with if you have it. It's basically eye problems associated with diabetes. And the issue is that if we fix this diabetes very, very quickly, which these medications can, that quick fix can actually make diabetic retinopathy a little worse. And so you want to try to avoid that. So if you have a history of that, probably shouldn't take this medication. If you've already had a history of pancreatitis, because this is part of where the medications work, or gastroparesis, which means the stomach doesn't empty well already. And if we were to give you medication that slows down the stomach emptying, that's probably not a good thing either. If you're really prone to dehydration, because potentially if you're not taking it, you're not getting your fluid in, you could have some worsening of any kidney function there. If you're pregnant, if you're breastfeeding, you shouldn't take these medications. Obviously, if you have an allergy to the medication, don't take the medications. And finally, if you're underweight, and there's no reason to take this medications because you very likely will lose weight. All right, so what is the treatment then? Okay, the treatment with these medications, semaglutide, tirzepatide, they're very similar. They're basically weekly injections. They're weekly injections in the subcutaneous tissue, typically almost similar to like an insulin injection, but literally even probably less so because they're the smallest needle just about they make. But you inject them into the subcutaneous tissue, into the abdomen or some fatty pad there. You do start really low. You want to start the medication at a very low dose and then very slowly increase. And typically what we'll do is we're going to increase it every month or so. Some of that is because it just takes some adjustment to the body to adjust to these medications. But also, we want to make sure that you're tolerating the medication. And then finally, we want to make sure, hey, is it actually helping you too? So it's adjusted very slowly to slowly increase the dose. I often see or hear people that want to go, can't we just increase the dose faster? It's like, no, you really shouldn't. You really should go through this slow adjustment, typically no sooner than once a month. And then finally, if you get to a level of this medication where you're losing weight really well, it's like there's not a reason, hey, we need to keep going up on the medication either. It is a medication that can be used long term, and both of these medications, semaglutide, tirzepatide, can be used long term. The really high doses of tirzepatide, which would be really rare if someone would need that, will tend to be more expensive. Tirzepatide itself tends to be a more expensive drug there. But both of them can be used long term. So what do we typically do? So semaglutide can, again, the dosing schedule is just a little example of that. Typically, we're going to start at the lowest dose, which is 0.25 milligrams. You'll do that for the first month. See how you tolerate it. See how your weight loss goes. Bump that up to 0.5 milligrams, which are then used for the next month, and kind of each month slowly go up. Um, Typically, the highest dose is 2.5 milligrams, which if you needed the highest dose, would take a good about 5 months to get to that. Okay. But do realize we're going to titrate this up relatively slowly, making sure you tolerate the medication, aren't getting a lot of side effects that are bothersome, and subsequently are you seeing good weight loss. With the Tirzepatide, very similar. It's a different kind of the size, if you want to call it that. The dosing is a little bit different, but the concept is exactly the same. That we're going to start with a really low dose, um, injected weekly for the first month, see how you tolerate that, bump you up to the next dose, slowly work our way from 2.5 milligrams all the way up to potentially 15 milligrams, although it's very rare that someone would need 15 milligrams once a week. Most people are going to be in these lower dose ranges. Okay, but again, once a month, we'll consider upping the dose about once a month, and that's really a discussion about how you feeling, are you getting the side effects, what's your weight loss doing, do you want to try a higher dose? So a lot of this is kind of patient specific, and it really depends on how it's working for you. Just to take that a step further, there's nothing wrong with switching between medications. You would very likely need to start at the lowest dose again. But if one medication, hey, this isn't working as well, can we try the other medication? The answer is yes. That's not a problem with trying another medication. Very similar to if we were treating your blood pressure, we may try different doses, different medications, and just see how does it work. And it may take some time to kind of sort that out. All right, so what do we see in results then? I mentioned that earlier. We're seeing very good weight loss is the bottom line. On average, with the semaglutide, okay, about 15% of body weight is lost during that first year. Now, there are some relatively shorter term studies about what happens after the medication is stopped. So once the semaglutide is stopped, what we're seeing is about potentially about 50% of that weight that is lost can be regained in that first year. Now, that sounds like, oh, that isn't that good. Actually, that's really good. Okay. Well, I'd like to say, oh, that's not good, but it actually is very, very good. And I think as time goes on, we may see this actually improve. And again, because that if we can fix or really treat that insulin resistance, this is one of the first medications that can actually treat this insulin resistance, which literally over 50% of the population is insulin resistant. Okay, but anyway, different discussion. If we can treat that insulin resistance, this weight maintenance is likely to remain better than kind of most other weight loss type of medications. So I'm really excited about this side of the whole thing. All right, Tirzepatide, fairly similar, actually a little better weight loss. And from talking to people that have utilized this medication, there potentially is a little less risk of some of the side effects. Although the side effects are basically the same with both medications. So with Tirzepatide, what we're seeing is on average about 20% of body weight is lost during the first year. Again, that 200 pounds, if you weigh 200 pounds, 20% would be about 40 pounds. Okay. It's really unknown with this medication how much will be regained after the medication is stopped. But again, I think the potential here is going to be very good if this really does seem to treat the insulin resistance there. So if insulin resistance is improved, I'm really excited about I think weight maintenance will be much better than many other kind of treatment plans. All right, so in summary then, both semaglutide and Tirzepatide can be very helpful in a weight loss program. Both are showing very good weight loss on average. Both of these tend to be tolerated well with minimal side effects. It's just kind of playing with the dosing a little bit and making sure you're going slow, cutting up things. You need to be kind of having that healthy diet. Lifestyle changes have to be made. Okay, but both tend to be tolerated pretty well with minimal side effects. We do not have long-term studies yet. We'll get them. It's going to take time. It's unknown really about the weight maintenance, but it really is promising. And I'm really excited about this side of this. I think this is going to be something that's better than many other weight loss plans. And the bottom line is this could be the answer to your weight loss difficulties. So, is this something you're interested in? I encourage you, contact us. The phone number's there, 757-873-1880. Contact us and set up a consult that we can sit down and go over your situation. These are medications that need to be ordered, so it's not like we can just kind of pull them out and start using them right away. If you decide this is what you want to do, we do have to order the medication, and so subsequently, it can take a little bit of time to get in, generally less than 2 weeks. The cost, it's not insignificant, but if you've paid attention to these medications or if you've looked into these medications, you may have found that, hey, both of these tend to cost about between $1,000 and $2,000 a month. This is kind of ridiculous, obviously. So, kind of, yes, we have a much less significant cost than that. It's not that they do, there is some cost, and we can make it much, much better than that. And even if you're trying to get started, we've cut the cost even further to try to help you get started, see if there's something that can actually be helpful for you. So, again, contact us. We'll be happy to discuss this further with you, as well as set up a consultation and we can go over your situation. All right, thanks for listening. Hit the, follow us on the social media, as well as give us a yell, either 757-873-1880 or email us success@cfwls.com. Thank you for listening. I hope to see you in the office very shortly. We'll help you on your weight loss journey. Take care, everyone.